Hello, everyone. A third ceasefire went into effect in Artsakh early this morning. However, once again, 45 minutes later, Azerbaijani forces violated this ceasefire, which was brokered over the weekend in the United States with the help of Secretary of State Mike Pompeo between foreign ministers Zohrab Mnatsaganyan and Ceyhun Bayramov. We are receiving reports that artillery shelling is continuing in various directions in Artsakh, both on the front lines and also in the civilian areas such as Stepanakert, Mardagert, Marduni, and we're following those developments for you. If you follow Asbarez on social media as well as our website, you will get the latest information. One thing that hasn't been that much discussed during the past month since the Azerbaijani aggression started is that this war is being waged during a global pandemic and against the United Nations call for a global ceasefire during the pandemic. The Armenian Health Ministry yesterday reported an incredible surge in COVID-19 cases in Armenia, saying that its hospitals are being overwhelmed by patients with new cases. In a 24-hour period, 2,314 new cases were reported, and the health ministry reported that 25,412 people are currently actively with the COVID-19 virus. I have invited today Dr. Vicken Sepilian, who is the president of the Armenian Medical International Committee, to discuss the COVID-19 surge and how this is impacting Armenia's capacity to deal with the other emergency, which is obviously the wounded soldiers and others that are impacted by the war. Dr. Sepilian, welcome. Thank you for joining me.
Thank you, Ara, and thank you for really highlighting and discussing various aspects of this conflict in addition to the war against the pandemic, the COVID-19.
Now, your organization is on the ground right now, and you're working directly with the health ministry to address the pandemic issue. Can you elaborate a little bit on what's going on right now and what are some ways to mitigate this?
Yeah, Ara, indeed, this was something that we were concerned with right off the bat. And there is good scientific evidence to show that during a pandemic, when there is war or a scenario where people have to be crammed or move around or shelter in a place other than their home in public places, these are conditions that are definitely ripe for a pandemic to spread and to get worse. And no doubt this was a part of the calculation as the Azeris and Turks made as they, opened fire. In reality, there have been tens of thousands of refugees, and they have had to leave their homes. The conditions where they leave in, whether they're buses or vans, that puts people in an enclosed space in close contact. And where they have to shelter once they get to a safe area also is potentially less than ideal and lends itself a situation where, again, the virus can spread very easily. Of course, another thing is that as we all get emotional and wrapped up and worried in what's happening with the war, what's happening with our brothers and sisters on the front lines, we tend to let our guards down. And this also can be seen in the diaspora, of course, whereas there are certain stringent precautions that we all should take regardless of where we live. But when our mind is somewhere else, when our mind is worried and preoccupied, it's very easy to see that we let our guard down. We tend to get more emotional, and I've seen this even in the diaspora, during sort of volunteering and relief efforts. And same we're seeing in Armenia. And these are things that we're discussing with our colleagues in Armenia. However, again and again, we're seeing that perhaps wearing a mask, perhaps physically distancing has not become a priority as a result of the state of our mind.
Mm-hmm. The international community of Red Cross today tweeted about how does one shelter in place during war, where a lot of residential buildings and whatnot have been destroyed as a result of the war. How does one shelter in place in Artsakh, Dr. Sepilian?
Well, that's something that is really on a case-by-case basis, and you can't make a general, you can't make a general guidance on that, other than providing the same guidances that have been given. Using masks, make sure that there is ample opportunity to clean, whether it be running water or sanitizer, making sure that the environment where these individuals, families, or groups are sheltering give the opportunity to properly distance themselves. These are all important guidances that we all should be keeping in place. However, from the beginning of the war, this was 4 or 5 weeks ago when the war started. Of course, we always were maintaining that message, but it was also easy to see that when you're talking to somebody in Artsakh, a health professional in Artsakh who's giving you a report, and you can hear the bombs in the background, talking about wearing a mask or physically distancing, it's a challenging topic to remind, and this has happened firsthand. This has happened firsthand where I was having a conversation with an individual, and there were bombs going on in the back, and he had to put me on hold just to say, I need to move to a different part of the building that is more secure, and so that we can continue our conversation. Interestingly enough, that same person who I was talking with ended up coming down with COVID.
Oh.
And had to be hospitalized and watched in Armenia. So those types of public health guidances are very, very important, that we all embrace in such a way that it becomes our norm, so that we don't have to even think about it. It is very difficult to do. We're a social environment. We tend to be emotional. We tend to be, on Saturday, I was in a warehouse where we were sorting out, surgical supplies, and there were about 30, 40 volunteers. The spirit was very high. We were in good spirits. And however, at several occasions, I had to remind people, guys, masks on, please. You don't have to hug. That's okay. We can do air hugs or whatever have you. These are all things that are ingrained in us. However, we really have to watch out and be careful, because as soon as we let our guards down, that's when we will get infected.
Give us an idea, where was Armenia before September 27th as far as COVID was concerned, and where is Armenia now, almost a month later?
So, Armenia has initially was on the path to be in the top 10, in the world per capita. In fact, the New York Times covered this on how Armenia was doing. However, with the proper, with the proper advice and the proper restrictions that were mandated, it looked like we had turned the corner. Of course, we didn't. The pandemic didn't go away, and it's one thing to keep in mind that just like everywhere else in the world, we cannot say that, oh, we're doing great, because that is just a snapshot. And there's plenty of examples in the world where a country or a city was doing great for a moment, it's important to know that whatever measures that were taken that mitigated the spread of the virus need to be maintained on an individual level. Now, Armenia had, was on the rise until some measures that were placed, including strict enforcement of masks. And it looked like we had flattened, so to speak, the spread. However, with the start of the war, and it's interesting, there are some graphs there are some metrics that are coming out of the American University of Armenia, and there's a public health working group with members through the diaspora. And yesterday we were in a meeting where one of our participants, who's a professor at Columbia University, Dr. Kim Hekimian, presented some data that showed how, sharply the increase of cases began right at the start of the war, almost a week or two after the start of the war. And this is, no doubt a calculated aspect of the war. That no doubt that the Azeris took into account before they attacked. We are on a pace that will likely, surpass the hospital capacity, and we're already beginning to hear that. One of our infectious disease experts who was on the front lines here, during the pandemic, traveled to Yerevan a couple of weeks ago, and we got a report from him yesterday. And indeed, he was reporting that the situation is approaching to be dire, and we're looking to send hospital beds, physical hospital beds from here. There are talks of converting various public spaces into temporary or field hospitals just to care for COVID patients. In addition to that, we are also in the process of sharing information on how patients who are infected with COVID can be taken care of remotely from home, and what are some of the guidances and things that can be done. And this was all things that we discussed with the Ministry of Health and shared this type of information with them. Keep in mind also, Armenia has done a very good job in terms of heeding some of the guidances and advice. In the Ministry of Health, including the Minister of Health, there's plenty of people who have expertise in public health and that are exactly well positioned to deal with a situation like this. So in one way, we're fortunate that we have the people with the right training in the right places. However, with anywhere else in the world, there is no country or no region that is consistently beating this pandemic. We may be doing very well at one point, but that's just the snapshot. 2-3 months later, we can be in a very bad situation, as it is evidenced in Armenia.
Okay. The health ministry said 800 people are currently hospitalized with serious COVID impact, and there's 450 waiting to be hospitalized. This also is happening, as we've been talking about, in the backdrop of war. Can you tell us what your organization has been doing with wounded soldiers, with the casualties that are coming in?
Yeah, Ara, so from the standpoint of, just to take a step back and give you an idea about the Armenian Medical International Committee, or AMIC that it's called. So the Armenian Medical International Committee is an umbrella organization. So it's an organization of organizations. And the member organizations are organizations that engage in health-related matters in Armenia and Artsakh, and for Armenians around the world for that matter. So we have approximately 20 groups that are members that are all over the world. There are 3 organizations that are here in Southern California, 1 in the Bay Area, 2 that are in Canada. There's 1 in Boston, 1 in Ohio, 1 in New York, Philadelphia. There's 2 in South America, 1 in Argentina, 1 in Uruguay, Paris, Lyon, London, the Netherlands, Germany, Moscow, and Lebanon. These are so it's a pan-Armenian diasporan organization that with a mission to improve health and healthcare for Armenians and health education. So from the first day of the war, we found out Saturday night here, typically we meet on Sundays, so we had an emergency meeting with attendance from the Ministry of Health, with attendance from representative from the President's Office of the Republic of Armenia, attendance from the High Commissioner's Office from Diaspora Affairs, and we sprung into action on first identifying what are the high priority needs in terms of dealing with battle type of a situation. And we took a multiple pronged approach. One of the first and foremost was to see what is urgently needed in terms of medical equipment, supplies, and medication. So we receive daily live requests from the government of Armenia directly. And we also make sure that we have a live list going that we update and we as we procure and ship these items to Armenia. So we've heard of the several air cargo planes that have taken off from the United States. We've played a big role in filling up those planes. Also, similar shipments have taken place from Europe, from France, from the Netherlands, from London. Moscow has been a huge one. And again, we, in a centralized live platform where the various agencies of the government are asking and we are fulfilling from throughout the diasporan world. We're trying to accomplish this in an organized, streamlined manner from different hubs of the diaspora. So medical supplies and equipment are one aspect of it. A second very important aspect is actual expertise, surgeons, vascular surgeons, trauma surgeons, nurses with operating room experience. So that's another live list that has been going on, and we make sure that we take care of all the logistics for these volunteers. We make sure that they have all the documentation that they need, and that they are picked up at the airport when they arrive and are taken to the proper institution that that expertise is needed. Other aspects that we've worked on are mental health issues, dealing with post-traumatic stress. Another task force is working on rehab issues, rehabilitation of soldiers who have been, treated and now are in need of rehab. We have another working group that is working on procuring big items like, ambulances. The latest ask has been in the past week of ambulances that can access that can access remote areas. The ambulances that we currently have in Armenia that are functional have low clearance and cannot go to some of the places where the soldiers are being wounded. So yesterday we've had several meetings on getting these Land Cruiser types ambulances that can go, that have 4x4 capabilities. In addition to that, getting rescue vehicles that are off-terrain vehicles, these quads that are used for snow rescue and remote area rescue, where it's very compact, it's able to go pretty much anywhere and can evacuate a wounded person from a place where the road can't get to. So people don't have to carry that person by hand. They can just simply place that person in this ATV and deliver them to a safe area where that wounded person can be triaged and then taken to the proper field hospital or physical hospital. So these are some of the things that we've been doing. We meet, there are several working groups and task forces that we meet on a daily basis, and we're just making sure that we meet the most urgent needs of whatever is deemed from the government of Armenia. We also are getting centralized requests. So if let's say a year ago, a hospital may have reached out to me and said, I need this equipment. Sure, we would have worked on trying to get them. Now we are asking anyone who reaches out to us, please reach out to the government representative and make sure that both from the diaspora side, things are centralized, and also from the Armenia side, that we know very well that we are communicating from a central, synchronized, unified channel on a bilateral basis.
And certainly when you said the war started and you began addressing this issue with government officials, there wasn't the anticipation that this was going to go on for a month. And as we're inching closer to winter, I'm sure that is going to bring its own challenges. And your organization will be probably working with that. We're going to check back with you on the Artsakh issues, because this doesn't seem to be ending, unfortunately, tomorrow or the next day. But the organization was kind of on the forefront of the COVID-19 battle when the entire world went into lockdown in March. Talk about some of the elements that you brought into the conversation, and how has that helped in the current surge that is happening in Armenia?
Yeah, that's a very good question, Ara. And to some degree, I have to say, the pandemic had helped in this situation insofar as making sure that these diasporan groups were already engaged. Now imagine we have an umbrella organization of 20 different organizations. We have common missions. However, each organization may have an individual preference. Some may be focused on oral health. Some may be focused on women's health or children's health. And in times of peace, or in times of where not much is going on, we get together several times a year. We organize conferences and continuing medical education and training exercises and events for physicians in Armenia, or other healthcare professionals, I could say. But when the pandemic broke out, it brought everybody's focus on one specific target. So we already were engaged, fully engaged, to see what we can do in Armenia. And right off the bat, the organization sprung into action. The initial asks were for actual supplies and equipment. And we provided whatever we could, in whether it be PPEs or medical equipment, ventilators, contributed to sort of maybe designing a ventilator in Armenia, and to the best of our capabilities. Then it became evident that the most effective and the best way that this group could act is to virtually connect with physicians in Armenia or healthcare teams in Armenia, especially bringing experts who are on the front lines, who are in some of the worst hit places in the world, in Europe, in New York on the East Coast, and connect them directly with doctors in Armenia to share firsthand knowledge and how to deal with certain types of patients and complications, how to set up a hospital ward to make sure that it is a properly contained COVID ward, how to prepare your outpatient clinic to make sure to mitigate the transmission of the virus, how to do, best practices in telemedicine. All these things were information that we shared with our colleagues in Armenia. All in all, we organized several hundred hours of telementoring and telelecturing, where thousands of doctors and nurses participated on an ongoing basis. Now, so these platforms that were here, Zoom or WebEx or whatever have you, maybe we used them, maybe we didn't, but these platforms also, and it's great that our colleagues in Armenia are very slick, very knowledgeable with technological aspects of communication. We're able to leverage these and use these to really access the maximum number of professionals in Armenia, whereas previously there may have been some, bureaucracies and political barriers, and but these types of virtual events, we were able to access, physicians and hospitals that in such a way that hadn't been done before. We also did, we had several times a week where we would do telerounding, rounds in the hospitals where a physician from here actually can be bedside, in Yerevan, and their, group of intensive care unit doctors would ask us questions, and we would have a panel of experts sitting right here in California, or sitting in Toronto or in Paris, answering questions directly, specifically on how to manage that, manage that situation. It was really one of these, scenarios where, I would participate on these just to moderate and make sure that things go smoothly. And, I would sit back and say, wow, it's like we have our ICU doctor who just got done with rounds at Glendale Adventist, now is doing rounds at the hospital in Yerevan, and we have multiple examples of this. So having been already engaged in rendering that type of, frontline advice, public health advice, both at the organization level, at the bedside level, at the nursing level, at the physician level, we were already engaged. And when the war broke out, we didn't have to sit there and say, all right, who's available and what's your time? We already knew. We were already meeting once a week with everybody. The subcommittees were already meeting several times a week. So it was able to continue or build up on that rather than sort of get it going from a resting phase into a working phase.
And let's hope that the aggression will stop. But good luck to you and your organization. I will be checking in back with you in a couple of weeks to get more insight on the war front. But certainly you and your colleagues have been able to create this international network of medical professionals who are learning from one another in this global pandemic situation, and are able to help our brothers and sisters in Armenia. Dr. Sepilian, thank you for joining me, and good luck to you with your work. Keep doing it. And of course, we are going to win this war together. And thank you all for watching.
Thank you, Ara. Thank you very much. Keep up these efforts. This is an important part of the fight.
Thank you.